I love who I am, and I don't care if you don't love that because it's my choice and my truth. I'm Kurt Coleman, and I'm amazing. Last time I had a spray tan was last week. This isn't even enough laser spray tan. Like, if you think I'm tan, this is not even tan. Like, this is white. I've had my lips done. I know you're jealous. I know you want my lips. I've had filler in my jaw and chin. I've had Botox before, but I've haven't gotten anything done for 6 months. So, it's gone pretty natural at the moment. It's literally just changing my hair. It's a little thing that I get done just because I can. I got famous off Instagram and Facebook and social media, and then it made me famous in real life. It's so weird because it's yeah, I'm off the internet, but people just love me.
Oh, aren't you great?
Every day someone at least comes up to me if I'm out. Get in. On the beach. Do you love it?
Yeah.
How I think about who I am and my self-love and respect, a lot of people don't have, but people have gotten it off me, and when they tell me that they've actually learnt that from me, it changes my life, every time. It means the world to me.
Kurt, you're
Hey.
19 now. When did you first start trying to change the way you look?
It was never really changing the way I look. It's just I've gotten little tiny things done. But yeah, 18.
Tiny things?
Yeah, well, I pretty much look exactly the same as what I did before. I got work done right now, so.
We got a photo of you at 13. Let's have a look at that. What do you think about how you look then?
I was 13. I look cute as.
So why did you want to change the way you looked by having things like the spray tan and the lips getting done?
Well, I get spray tans because I don't like burning my skin. I have skin cancer in my family, so I just don't want to get that. And I just got my lips done because, I don't know, it's just I thought it would just be fun to try. I never thought of it as in I hate what I look like, I'm gonna get this done. It was just a tiny thing that I tried to get. I just do it because it's creative to me. It's just playing around with what you look like. Don't people change their hair because they want to play around with what they look like and get their teeth fixed? It's just stuff like that. I don't do it to change who I am.
Rita, you're 22. You have work done too. What do you get?
I get Botox, fillers, and that's about it for now.
And when did you start getting that work done?
I started at 19, so it's been 4 years now, and I really enjoy it. It's been something that I've always been into. I like beauty. I like women that take care of themselves, and I've always been comfortable with my look, but I wouldn't mind tweaking some things around and really feeling the same way on the outside like I feel on the inside. So my look really changed the past couple of months when I went really bigger with my lips and I was able to go every month or every 2 months. But not much has changed.
Why did you get more work done in the last little while? Why did you want to do that?
I've always wanted to build up my lips. It takes time. And now financially, I'm more comfortable to be able to, support myself monthly filler-wise.
Why did you start Botox?
Because what people really think Botox are for older, women, but not really. Botox is to stop your muscles from moving, which means you get wrinkles from constantly moving a certain muscle and it itches in. And with the Botox, simply, I won't be getting any wrinkles anytime soon. So it's great.
So how much can you move your face?
I can move this part, not really my forehead or anywhere here.
So where do you get Botox done?
I get it
on
in
your
my
face?
upper face, not really in my... I did get it on the side of my eyes once, but it doesn't move anyway. So my doctor thought, what are we doing? Why put it on the sides of my eyes?
So can you smile? Can you frown?
I can't frown. I can smile.
Why was it so important not to be able to move your muscles in your face?
I always didn't like it. When I see people with a lot of movement in their face, and movement obviously varies from a person to another, but it really makes me cringe a bit when I see like the forehead going all up and liney. It just gives me this feeling.
What's the feeling?
I don't like it.
You came to Australia from Kuwait
Yes.
as a student when you were 18. Did you notice any difference in attitudes about appearance between
Yes.
where you came from in Australia?
It's way more relaxed here. It's way more casual. I learned to tone it down, heels-wise in the morning or dress-wise. Makeup-wise, I can't tone that down. And it's very common back home. It's the normal back home. So that's how I grew up and that's how I'm comfortable.
What do you think of how you look now before you had the fillers and the Botox?
I never liked my top lip. That's the only thing to me that I would keep getting done. Like, I will not let my top lip shrink anytime soon.
What was so bad about your top lip?
Okay, so I worked in media, in TV. I had a TV show at 15, so I was constantly seeing how I looked on screen, right? So I have very small teeth and I had really big gums and a small top lip. So all you would see is like a gummy smile and nothing else, right? So I got my gums reshaped and yeah, and still went back on TV and there was still something missing.
Okay, Summer, you're 17
Yes, I am.
and you're still at school.
Yes.
You've also had cosmetic work done very recently. What have you had done?
I've had lip injections in my top and bottom lip.
And why did you decide to do that?
I did that purely based on my self-esteem and my confidence levels. They just weren't up there, and I felt to feel confident about myself to get them.
Tell me a little bit more about that. How did you feel about yourself?
Well, I felt pretty low about myself and like appearance in my age and the society we live in. I feel it can make a big impact on like who you are liked by, because there can be bullying about how you look and things like that. So I felt it was pretty important to get it done.
So where did this idea come from?
It was about, I reckon, halfway through year 9 where
Probably.
Yeah, I saw like others with prettier lips and I was just looking at myself in the mirror. I'm like, well, where's mine?
yours? Yeah. I think I gave her the thin lips, but
Mum.
yes, Mum, yes.
So when she started saying that, what was your reaction?
First of all, my reaction was, oh, you're beautiful the way you are, you know, you don't have an issue, you're awesome, all that sort of stuff, generally what mums say. And she sort of kept the feeling kept arising, and we'd chat about it. We're pretty open and got a good line of communication, and it was sort of bothering her more and more.
Like a year and a half it
Yeah.
lasted.
Yeah.
Up until now, pretty much.
Yeah, it did. And I thought, oh, you know, gee, there's so much stigma attached to it, to having procedures done. And given Summer is under 18, that was another hurdle as well. And Summer sort of researched it, didn't you, Summer?
Well, for ages, looking for somewhere that would do underage lip injections.
And look, I wasn't opposed to it.
Well, you knew how important it was.
Yeah, and it was really important to her, and I think especially in adolescence how impressionable and vulnerable they are in that
But
sort of...
all adolescents are impressionable and vulnerable to some degree or another.
Yeah,
and
especially.
adolescence is a classic time when people are preoccupied with
Yeah,
their
it can
looks.
be a really horrible time.
Can I just throw it out there? Does anyone have anything they'd like to ask anyone, or, you know, who's got a comment to make here?
Just a question for Summer's mother. Being only 17 years old, are you worried that she might become dependent on cosmetic work because she started so young?
Sure, no. Look, to be honest, I hadn't thought about that. Summer's not really like that. If I was worried that it was her way, she felt good about herself only, sure, I probably would, but no, I wasn't worried.
Yep.
Have you found it's been positive for you? Like, has it had any chance of like an adverse effect? Have you been teased because you got it done?
Actually, no, I haven't. Like, all the girls that I'm involved with at school and outside of school, they're actually quite jealous, I guess you can say, because it's kind of what the trend is I see around these days. Everyone wanting to get lip injections, like, you know, seeing Kylie Jenner get them and stuff. So yeah,
So that was a big influence on social media?
kind of. Like it was more kind of, not so much an influence. Like the only influence, I didn't really have one. It was kind of just more for myself,
It was a
not to be
combination,
anyone.
wasn't it, of sort of a
But,
lot
like,
of things?
Yeah, if other people are getting them done, then why not me? Because it's going to help me feel better
But
about
you also
myself.
said there were self-esteem
Yes.
issues that you had that were driving it as
Yes.
well, yeah?
Yeah, for sure.
And you thought it would change your life in some way.
Yeah, make me feel confident about myself for sure.
Sarah, you're listening to all these stories. You're a clinical psychologist. You specialise in body image. What do you make of what you've heard?
I'm certainly not don't want to come across as criticising anyone's individual decision, because it sounds as though everyone's gone through a process to make that decision. But it's interesting to me that, you know, when I look at pictures of each of the three of you, you're all gorgeous people. To me, there seems as though there's a problem in our culture that we need to sort of fix ourselves to feel as though we fit in or to feel as though we're attractive. To me, that's a cultural issue. That's not that there's something wrong with the way anybody actually looks.
What do you think is happening in terms of our attitudes to getting cosmetic procedures done? I mean, you deal with
Sure.
people who have
Okay.
body image issues all the time.
Absolutely.
What's
So,
going on?
I think there's two issues. One is there may be a medical necessity for some sort of cosmetic procedure. The other side of things is when it's driven by fashion and, you know, what happens to be the fashion of the time. And I think one of the issues here is the fact that if surgery is being sought for certain reasons, particularly reassurance seeking, we can't sort of fix an internal issue, a psychological issue with a physical intervention. And so a physical intervention it may result in increased self-esteem, and it sounds like you've had a really positive experience, Summer, but for a lot of people, that may not necessarily be the case. Another issue, though, that I think we need to be talking about when we're thinking about 18 and under, and particularly younger groups, is right to childhood and right to feel safe in your own skin, and the cultural impact of normalising procedures which may be medically safe. Maybe in 40 years' time there's no impact. But if this is mainstream for 17, 16, 15s, and, you know, where does this stop and where do we draw the line?
How normal is it, do you think?
What, injectable?
For people to get injectables, Botox, young people, I mean, under 25s. Yes.
Well, I'm in HSC and I see people with lip injections at my school, and there's a kid with butt implants.
And why do you think that's happening?
Well, because you've got society's views, and then you can't be perfect. Like with your self-esteem issue, if you had problems with self-esteem, why would you go get a lip injection when you can't work that out with yourself? Do you understand what I mean? I don't mean to be insulting or anything.
Wait, what do you mean?
Like, if you have a problem with your self-esteem, why wouldn't you try and fix that on the inside instead of trying to fix it on the outside?
Because that's the cause of it.
So if you have small lips, then I can understand how you can fix it with Botox or lip fillers or something. But if it's another problem, you can't always fix it with plastic surgery. Like, you need to be able to stand on your own and be able to fix it by yourself.
But if you can fix it, why not?
There's that point too.
Do you really believe that that's the case, that it's all about your lips? Do you
Not
think?
entirely. There are some other things, but yes, it definitely plays a role in it.
Okay, so since you've had it done, how's your self-esteem been?
It has risen for sure. Feeling more confident, not having to worry about my appearance as much and what others view me as.
Ashka, you're a cosmetic nurse who specialises in injectables. How often are you giving injectables to people under 25?
I could probably say most days of the week. It's quite common, very common. And I must say, ever since the Kim Kardashian and the whole Kylie Jenner trend shot on TV, I have younger patients coming in with the picture of Kylie Jenner and asking me to do similar enhancements or whatnot.
How often would that happen, that someone would bring in a picture of Kylie Jenner or somebody else and say, I want to look like that?
Every second day. It is quite common.
Wow.
And what's your most popular procedure?
Lips, cheeks, and anti-wrinkle injections. So it is
And has
quite
that
common.
changed? Like, have you noticed trends in different things
Absolutely.
that are more popular?
10 years ago, when we have started, we had a lot of older patients going through the clinic. And 5 years ago, this increased trend of younger patients coming in, trialing the procedures, it's more about preventing rather than restoring. So it's trying to look fresh and feel younger. Even though they're so young, sometimes preventing the actual aging process is that's what they're looking for.
How much work have you had done yourself?
Look, because it's so readily available for me and because I do those procedures for patients, I always thought it's a good idea to try. And because it's available, why not? Look, does it make me feel better? Yeah, absolutely, I feel better
When
about
did
myself.
you start?
I've tried my lips when I was 22.
And what have you had done?
I've done my lips, I've done obviously the upper face anti-wrinkle injections.
Botox?
Yeah, Botox. And I've tried masseters as well, but that was mostly for grinding my teeth. So it was more of anatomical problem there.
And have you at any stage have you been consistently using those things?
Look, it is...
Since that age? Have you thought about stopping?
It's very hard to stop. So it is in the form of not addictive treatment, but it does make you feel better.
Okay. Meredith, in London, you've spent more than a decade looking at why people change their bodies. Now, anecdotally, we're hearing that more and more young people are having cosmetic procedures. Why do you think it's happening?
It's happening for all sorts of actually very sensible reasons. So one of the things I've been concerned by listening to the show so far, and especially listening to Summer and to Summer's mother, I've been concerned by the way that the idea of young people seeking these kinds of less invasive cosmetic surgery procedures like Botox, like fillers, the idea that they somehow need to be pathologised and that they're somehow ill and that they need psychiatric or psychological help. Then the criticism of Summer's mother, I'm very uncomfortable with that, this implicit criticism of a mother who really has done something that's actually very sensible in terms of the world that we live in. And if we compare their decisions to say something like putting orthodontic braces on a child, then if you go back to Sarah's comment, which was, you know, children have a right to childhood, how on, you know, there's a whole lot of hypocrisy here. Where does your childhood go when you've got a mouthful of metal? You know.
Sarah, can I get a response from you?
Sure. I hope that the impression I have, I've tried very hard to not pathologise Lisa and Summer. That's the last thing I would want to do, because it sounds to me as though this is a decision that has been thought out very carefully and very considered, not reactive. But I disagree with you in the sense that I do think that we have a responsibility to help young people to feel safe in their own skin. And I think that's the thing that we're talking about here that's potentially a slippery slope.
Yeah, Meredith, do you think it's kind of fine for anyone to do anything?
No, I don't think it's fine for anyone to do anything. I don't think it's fine for people under 18 or under 16, whatever the nation's age of consent, if you like, is, to do permanent changes. But I'm also very aware that we, as a culture, we do many things to children that permanently change their bodies. And again, I go back to orthodontics. No child who rocks up to an orthodontist and says, I want my wonky teeth fixed, is then sent off to a psychiatrist or to a psychologist for assessment. Our culture just accepts that it's better not to have crooked teeth in ways that we don't accept it's better not to have a thin top lip. And I'm speaking as a woman with a thin top lip.
It might sound really strange, but fillers and Botox frighten the hell out of me. But I've had some serious work done.
So when did you decide to have surgery, to have labiaplasty?
I would think that I'm abnormal and nobody would want me.
My
Rita, what reaction have you had from family and friends to the work?
The border, that was really good.
Had
I've got the
amazing
habit of watching
reactions and
Crimes
not
of
so
Passion.
good
I'm in the middle of
ones, which is
our
me about
Angleby at the
those.
moment.
All
It's
of them.
very different.
I got the
I
good
started
ones,
to watch
which are
track and
like
I had to watch all of them all at
you
once.
look the way you are, or like my personality
SBS on
just
demand
suits me
in
more
3
now with the
words.
bigger
Cheaper
lips,
than
so I've
Netflix,
gotten that a lot.
exciting,
My mom likes it. I think she
available,
doesn't want me to take it too
binge
far with the
watch.
lips, like go
Count that as 3.
plastic positive like I am.
Rita, what reaction have you had from family and friends to the work that you've had done?
I've had amazing reactions and not so good ones, which is
Tell me
pretty
about
normal.
those. All of them.
I got the good ones, which are like, you look the way you are, or like my personality just suits me more now with the bigger lips, so I've gotten that a lot. My mom likes it. I think she doesn't want me to take it too far with the lips, like go plastic positive like I am. I would say extended family members have definitely made comments like, you looked way better before, you looked like more innocent, and I'm like, I was 15.
You post your procedures on social media too,
Yeah.
like Kurt, in graphic detail, I might say.
Yes.
And I should warn everyone to look away if you're squeamish about needles. Anyone? Let's have a look.
I'm in Aunt Naomi's. Isn't she so pretty? This is the best feeling in the world.
Sorry, darling.
All good. So pretty.
I don't like the numbing. I enjoy it.
What did,
It's okay.
What did you say?
I was asked if I get numbing. I don't.
You said it looks so pretty. And I'm looking at it with, you know, a lot of people with their eyes shut going, oh my God, that must really
Yeah.
hurt. Does it hurt?
It does hurt. Well, yeah, the pressure of having fillers going to your lips, that does hurt.
Why do you post that stuff?
I feel like it's very empowering to be able to say that, yes, this is not 100% me, that I did not wake up like that a couple of years ago. I feel like the only reason this is becoming new is because now people are confident and able to say that, yes, I get work done. Although we have grown up seeing celebrities and beautiful women on the streets and thinking, can we ever look like that? No, we can't. Because when you ask them, they tell you, oh, darling, it's all natural. And it's not. You know what I mean?
Gemma, what do you think about the idea of all of this?
I'm going to sit on the fence here because I've had extensive work done and permanent work. So, and it might sound really strange, but fillers and Botox frighten the hell out of me. But I've had some serious work done.
What have you had done?
I've had my excess skin removed off my stomach.
This is after losing a lot of weight.
Yeah, I nearly lost half my body weight, 54 kilos.
I've got a picture of you there before and after.
Had my abs put back together because I gained so much weight so dramatically over my teenage years, and I had my breasts fixed too after being a G cup. They went to a B and didn't really sit in a bra anymore. I'm 25, so I saw so many of my friends go through this process of having breast augmentations and just for the fact to have bigger boobs, not because they wanted them necessarily, because they thought that's what boys wanted, I guess, and they got them, at 22. And I always kind of questioned and queried their, why they did it. Yeah.
I'm interested in why you sit on the fence when you've had such major surgery, and I'm just interested in what...
For me, I made the decision to get my surgery, and it was not an easy one. After spending a lot of time with my girlfriends, I hadn't seen them for 9 months, and I dropped 40 kilos. So I saw them for the first time, and I had some pretty harsh comments made to me, not as a nasty thing by them, but I remember sitting self-tanning on the floor with them before going out, and them saying, oh, your boobs look like sand in socks. And it was just it was nothing nasty meant, but it was just us mucking around, I guess. And I just went, I never thought of that. I looked in the mirror, I had excess skin of a woman that I was not proud of anymore. I saw her as weak and someone that made bad decisions. And
So I'm interested in why you have reservations about some of
Plastic
the other
positive.
things, and I'm not being
Yeah.
critical of that, but I'm really interested in how you react to some of the stories you've heard tonight about people getting, you know, Botox and fillers.
It frightens me. I don't know why.
I'm interested in why.
I just look at people's faces and I think you're beautiful. Like there is no, but it just frightens me. I don't know why.
What is it about it that frightens you?
It's your face. It's the first point of call. Like I'd love to sit here and tell you that I didn't get cosmetic surgery because of what other people thought of me. That would be a lie. I could see it straight away with people, the way they treated me, the way I interacted with men. I remember, and losing weight so dramatically as well, before even getting the cosmetic surgery, gave me exposure to that, because for once in my life, in my teenage life I should say, I was noticed. And yeah, so that's...
But there's something clearly that unsettles you about the broader issues here.
I just think that everyone's beautiful in every way. You know, everyone has their flaws, but you should love your flaws. And I know people can look at me and go, well, you should have loved your skin, it is your story. I just worry that if you're making that decision, what is the foundation of that decision and why are you making it?
So what wouldn't you have done?
I wouldn't touch my face. I am going to go back and get my legs done. I have I'm going to get the excess skin removed off my legs. But yeah, probably I just wouldn't touch my face.
Farani, what about you? How long have you been thinking about having a cosmetic procedure?
Well, it first came up to me when my mom told me the story of when I was born. So when I was born, actually, the nurse just had a look at me and she was like, why is her nose flat? And then I started growing up and it got really worse because like my family started saying like, you know, like they started touching my nose a lot. And then at one point, my mom actually took like a clothes bag and put it on my nose to
try and change it.
Yeah, to try.
How old were you when that happened?
I was probably in like primary school. Yeah, I remember like it was like...
You didn't go to school with a peg on your nose?
No. It was like an after-school activity with my mom. She was like, yay, you're come back from home, come here. And she...
So what was going on in your head all the time that this was happening?
I'm ugly. That's the only thing. And I was like, and my cheeks are naturally chubby as well. So, you know, having a flat nose and a chubby cheek, it's like the combination of disaster for everyone in Indonesia. So it was like...
Why is it the combination of disaster for everyone in Indonesia, which is a big generalisation?
But it's really a thing because like there's a financial side to it. So Indonesian, like most of the people that I know, of course, they relate beauty to richness. They relate beauty to fortune. So you have to be beautiful in order to gain financial gains.
So when did you start thinking about having nose surgery? How old would you have been when you first started thinking about that?
I started thinking when I was in primary school, actually.
So do you want to have it done?
Maybe. Like, because there's also this, I'm a Korean pop fan, and Korean pop has a lot to do with plastic surgery, obviously. And a lot of because my standard of beauty is by looking at them, and obviously I don't look anything like them. And it just kind of like makes me think like perhaps one day if I fix myself and I look like them, maybe I will feel better, kind of thing. Yeah, because it's like I'm good at other things, but there's always this underlying sadness of having me not looking perfect, not having the perfect feature. Yeah.
And do you think it would make you feel better?
It would certainly make me feel better because there's this promise in Indonesia that if you look beautiful, then you will marry rich people. So that's why I'm trying so hard in school right now because I'm not.
So you're after a husband, right? Is that what's at the heart of this?
There's this underlying message that my mom always tell me, like, you know, you should ace school because, and then she was kind of quiet, and I was like, yeah, I'm not gonna marry a rich guy. That's why, Mom. And she was like. I was like, yeah, that's why like I'm trying so hard to kind of like fulfill the other parts because this feature is bringing so much down, like a downside to my life. So I need to fulfill it in other parts.
I think you're really pretty.
Oh, thank you. That's a first in a month.
Seriously, like I don't think you should do it for those reasons, not because like you want to marry. Someone's gonna like you for who you are. Do you know what I mean? Like,
And have your attitudes about any of this changed since you've been in Australia?
Definitely, because like I feel like Australia is very welcoming towards any kind of body image, more welcoming at least. Because like when I come here, every time I come back to Indonesia, actually, the first thing that they say is that, oh my God, you gained weight, or like, oh my God, you got uglier. That's the first thing. They don't even ask about my school. They don't even ask about how I'm doing in Australia and anything. The first thing that they do in Indonesia is that they see you and then they judge you from your appearance.
You were in Korea recently. What happened in Korea?
Yeah, so this girl just pulled me and she was like, hey, you kind of need a plastic surgery.
On the street?
On the street. And then she just sat me there. She took a picture of me and she was like, which part of you do you want changed? And I'm like, nose. So she photoshopped a nose of a favorite actress, a Korean favorite actress of mine. She just put it on my face. It looks kind of weird, but I see where she's going, and it's like...
How do you feel about how you look now?
I'm not completely okay with how I look now, but I feel like the more that I grow with age, the more that I become more accepting of how I am, the less that I go back to my country, the more that I become more accepting of how I am.
Emma, you thought about having a cosmetic procedure for a long time too. Tell us why.
Okay, it started when I was quite young. I had 2 stepsisters and a stepmom. So as kids, about 7 years old, we all had baths together. Now I started to look a little bit different down there to the other 2 girls.
This is your labia?
Yes, my labia. And it started off with my stepmom actually pointing it out, and then my stepsisters would laugh at me about the way I looked. And so from then on, I pretty much decided not to ever get naked in front of anyone again.
How did that affect you apart from that decision, not to be naked in front of anyone? I mean, what went through your mind when you were laughed at?
It made me feel like there was something wrong with me, like I was abnormal, like I shouldn't look the way I do. At one point, I got so frustrated that I actually just wanted to cut it off.
Yourself?
Yes, myself. Because I was just terrified that it was so abnormal.
What about when you were old enough to have a sexual relationship?
At 16, I had my first partner of long term. And because when you go through high school, when you have sex education, you know, they tell you all the time, you know, boys' penises, they're different shapes, they're different sizes, they go to different sides, you know. But for women, they just say, you know, this is how you look, that's it. No one tells you that there's different shapes and sizes for women as well. And when it came to my first sexual encounter, he made an offhand comment that I was weird.
That you looked weird?
Yeah. Yeah, and that I was different.
And what was that like for you?
Shattering. It made it really hard to feel confident in my own skin.
And how long did that go on for in terms of sexual relationships? Were you in that relationship for very long?
I have only just gotten out of that relationship. It lasted for 6.5 years because it turned out he was emotionally abusive. And of course, I felt like I could not get any better because he used to tell me that no one would want me the way I am. So when it came to even considering leaving him, I would think that I'm abnormal and nobody would want me, so why bother, basically? I might as well stick with someone who knows what I look like and what I am like, and yeah.
So when did you decide to have surgery, to have labiaplasty, and why did you decide to have it?
I had been thinking about it for years. I even discussed it with him, but he sort of changed his mind on it and was just like, you know, I love you exactly the way you are, but it still rang in my head, those first words he said, like, you can never get rid of it, no matter what.
What happened when you told your GP you wanted to have surgery?
She thought it was ridiculous because obviously she's seen a lot of vaginas, so she knows what's normal and what's not. And she just sort of brushed it off like, oh, there's no point, why bother, you know? And she was the only other person that had seen me naked other than my partner of 6.5 years.
And why did you finally go through with it, the surgery?
I wanted the confidence to be able to get out of the relationship I was in, and
you needed to do that to get out of the relationship?
Not just that, but I've been scarred since I was a little kid, emotionally, from all the teasing, from everything, and you just don't grow up thinking it's normal.
If somebody had been able to prove to you that, you know, there were just a wide variety of different shapes and sizes that women come in, would it have made a difference?
Well, when it came to the stage of me researching surgery, I did discover that, but it didn't make a difference because the damage was already done and I couldn't undo it because it was so far down in my core that I wasn't right, you know? And so I went through with it. And I have never been happier. I've never been more confident. And I mean, I've only had one other sexual partner since, but I'd never felt like I had to switch off the lights or hide myself. I could just be myself. And I felt comfortable.
Gemma, you research why women have this surgery. Do those sort of reasons come up very often?
Absolutely, and I really applaud Emma for telling us this story, because when we do get those comments, particularly from a young age, then from a sexual partner, and then a GP, it is completely understandable that Emma wanted to have labiaplasty, and it sounds like she had a really good experience and she's already got into a new sexual relationship. So it sounds like she's a really good candidate for surgery, and I think that's very important, identifying good candidates for surgery. So yes, definitely negative comments is a strong influence for why women have labiaplasty. Another thing which has come up in the show already is media influences. Pornography is something that's come up in my research a lot, but also fashion trends like wearing yoga pants and gym wear. So it's not just how women's genitals are portrayed naked in pornography, it's also how they're portrayed clothed as that smooth curve, which is considered to be the genital ideal.
How long was it after they made contact with you that you went in to see Dr. Kim?
Oh, 1 week, about 1 week.
About 1 week. How long after that did you have the surgery?
3 hours.
Edward, you're 21. You recently had double eyelid surgery. Where did you get the idea to have that done?
Actually, I did some research about years ago, and I'm really interested to have more attractive face. The most important reason is I did LASIK
What's not to love
about 2
about
years
Station
ago,
Horizon?
3 years ago.
Complete
And
season
before the
now
LASIK,
streaming on
I had very bad
SBS on
eyesight.
demand.
My right
Edward, you're 21. You recently had double eyelid surgery. Where did you get the idea to have that done?
Actually, I did some research about years ago, and I'm really interested to have much more attractive face. The most important reason is I did LASIK about 2 years ago or 3 years ago, and before the LASIK, I have very bad eyesight. My right eye 3 times worse than my left eye. So I didn't know the reason, and when I see Dr. Andrew Kim, and he advised me it maybe have the right eye has lazy eyes. It may affect the eyesight of my right, so it's better to have the enlargement surgery.
What's the change, though, when you have double eyelid surgery?
Double fold surgery is, if I speak very easily, is just eye enlargement surgery for Asian people. It's just racial feature. We just born with.
So what do you do to the eyelid?
It depends on the case. I put the thread through, especially young people, and I create the double fold. That means I make eyelid more exposed. It just lift the eyes up. So when it opens the patient's eyes.
Edward, What influenced you to get it done?
Actually, when I'm at young age, like 14 or 15, when looking in the mirror, I feel my eyes a bit uneven. Right eye is a bit smaller and look a little bit sleepy than the left. And at that time, I was thinking about maybe I need to do some surgery on my eyes, like make it look equal.
How did you come across Dr. Kim?
Through my friend of mine on WeChat. Yeah, she has done the surgery as well, and I can see it's really good result. And I'm interested, like, ask her to introduce to me, like.
So Dr. Kim was introduced to you, or you? How did you come into contact with one another?
By his staff.
His staff contacted you?
Yes. Actually, I was introduced by Lion to Joanna because I saw Lion's moment, you know, like the status. It says finding a model to be in the show.
Via WeChat?
Yes,
yeah?
via WeChat.
And what did they say when they contacted you?
Actually, at first time, she, like about a year ago, she told me there's a show going on.
A television show?
And finding young people to do the surgery.
So you heard about a television show. There was a message from Dr. Kim's office about wanting people for a television show that you came across.
Yes.
Okay. And what was the deal with that television show and getting the surgery done? Would you get a discount or?
Yes, just a little bit discount. But at that time, the show was cancelled by some accidents. And then about a month ago, and Joanna called me again and said there's another show going on.
And that's this show?
Yeah, this show.
Mm-hmm. And what were you told? So Joanna is from Dr. Kim's surgery?
She told me to come to the clinic to hear the advice first. And then, but Dr. Andrew Kim said my right eye is not really good for the show.
Did your clinic contact Edward and say, if he comes on the show, you know, did he want to have surgery to come on television?
I summarized the story. About a year ago, there's one of the television company. They contact me. They want me to perform the surgery. They want to film the surgery.
Mm-hmm.
So I was looking for the model who can participate in the show. And it's not very easy to find someone who wants to be operated on the TV and they want to show the appearance.
Did you offer him a discount if he'd come and have the surgery done to be filmed on that program?
Yes.
You did?
Yes.
Okay, so let's fast forward to now, and your staff contact him again and say, is he interested, because he didn't go ahead with the surgery before.
That's right.
The point I'm trying to get to here is, and I really want to be clear about this, because we contacted you early in our research. We asked about your practice and whether you had any young patients who might be interested in sharing their stories about having surgery. Yeah. We had no idea that you'd actually be contacting people who hadn't had surgery, young people who hadn't had surgery, and rolling the whole idea of being on television, rolling that idea together with having surgery and consulting with somebody and actually, you know, encouraging them to have surgery effectively.
I wasn't encouraging him at all. I just made him, I just heard there is a patient who is interested in eyelid surgery in association with the TV shows. So what I told my staff was ask him to come and see me. That's the start.
So Edward, you went and saw Dr. Kim. How long after the office contacted you did you have a consultation with him?
Oh, 1 week, about 1 week.
About 1 week.
Yeah. I just schedule my time.
And how long after the consultation that you had with Dr. Kim when you saw him, how long after that did you have the surgery?
3 hours. Me and my girlfriend keep discussing like, do it or not.
3 hours later, you're having the surgery.
Yes.
Do you often operate like that, Dr. Kim, on the same day as a consultation with a brand new patient?
It's pretty rare situation. I ask for the patient, and my staff show me his photos. And when I look at his photos, his eyes are not just a fully cosmetic case at all. There's one side he got lazy eyes. I picked that up. And then I told my staff that he's not for the cosmetic surgery in young people in inside show. But my staff told me he wants to do the surgery somehow. So I asked him to come and see me. Okay? See, normally I don't have time to do the consultation and the surgery on the same day. But when I look at Edward's eyes, it's not only straightforward cosmetic case.
But if it's complicated, wouldn't that be an argument for waiting a bit longer?
Yeah, I suggest him as well. I suggest him do it about a week later. But he got some personal reason that he really wants to do early. But that time, he's been thinking about surgery for quite a long time when I assessed him.
Ghazi, can I ask you about this? You represent plastic surgeons. What do you think about a situation like this that we've just talked about here?
I'm worried about that. Generally speaking, for any elective or cosmetic procedure, we would normally recommend that the patient has 2 separate consultations prior to any surgery, and that we would normally recommend to our members that a 10-day cooling off period between those consultations and any proposed surgery. I think you'd be concerned about their level of informed consent, their ability to have potentially processed the magnitude and the nature of what they were getting themselves into, but also have been able to process the potential risks.
Andrew, your response?
Yes, normally I don't have time. I don't have time to do consultation and surgery at the same time. But that particular day, he was the last patient. And I had enough time to perform the surgery comfortably. And I having performed this surgery over many thousand cases. I'm a cosmetic surgeon, but I do perform double fold surgery as my main specialty. And I do that more than anyone else in Australia. That's what I believe. And when you look at the new guidelines coming along from the 1st of October 2016, the guideline speaks of a minor and major procedures. Minor procedures are, there's no mention of the cooling off period. I consider this case as a minor procedure.
Ghazi, do you know how it would be?
With the guidelines, what the medical board has basically said that a minor procedure is something which does not involve cutting below the skin. So essentially anything that involves cutting below the skin surface would still be major. I don't know the procedure that Dr. Kim performs, so I guess I can't comment.
Do you cut below the skin when you do your surgery? I
cut the skin layer, but as he said, the definition is not below the skin layer.
How often do you see young people in your clinic, like under 25?
Oh, quite often, very often.
Mm-hmm. Do you ever question the reasons why people might want to have it done?
Yes, there is a good reason for it. There's good reason for it. Usually, especially very young people who come along, they have some complex or they have a bullied at school. That how come your eyes are so small? How come you got ching-chong eyes? So they have very hurting story. Their ego is get hurt. So these people, they don't just come straight. They've been talking a lot with their parents. So they have supportive parents, and they come for the consultation. Then we talk a lot. Why you want to do that? And normally, I usually judge the how physical they are fit for the surgery.
Ghazi, beginning this month, there are new guidelines for cosmetic procedures in Australia, and you perform cosmetic procedures as well. as plastic surgery. How are they going to work, those guidelines?
The guidelines basically are around cosmetic procedures and cooling off periods, and also, as Dr. Kim has pointed out, between major and minor procedures. As of October of this year, any person over the age of 18 who's contemplating having a cosmetic procedure, the medical board recommends a 1 week cooling off period between the consultation and the procedure. So the guidelines for under 18s are a cooling off period of 3 months. But on top of that, an under 18-year-old for a major procedure is also assessed either by a psychiatrist, a psychologist, or a general practitioner who is not associated with the practitioner performing the procedure.
And what about minor procedures? What are the new guidelines for those?
So the guidelines for minor procedures, and I think we would include injectables in that minor procedures, are for adults, there is no requirement for a cooling off period necessarily for an over 18, but for an under 18, the recommendation is a week.
Farani?
I feel like cooling off period is really important because that time when she photoshopped my nose, the other actress nose to my nose, it makes me kind of excited. It gets me to a lot of excitement, like, oh my God, this is like the new look that I'll be looking and blah, blah, blah. And when she keeps on talking about it, it just kind of like caught me on and caught me on. But then that moment when I had that time after the consultation kind of thing, that moment when I have my time alone to think about it again, then I came to a realization of what I really want, and like that kind of excitement is just on the moment kind of thing. Yeah.
Edward, would you have liked more time to have a think about it?
I think 3 hours more than enough.
You thought 3 hours was more than enough? Yeah?
Yes.
Summer, will you keep getting lip injections, do you think?
Yes, for now.
For now?
Yep.
Do you think can you imagine stopping?
At the moment, no, not really. It's something I enjoy, so why not?
Lisa, will you keep paying for them?
Well, we'll come to an arrangement.
Rita, do you have plans to get other work done?
Not now. I'm very comfortable now, but maybe, yeah, when I'm older after some kids and stuff, you know, mummy makeover is fun. Get it back.
And what would a mummy makeover involve?
Depends on how bad the baby wrecks my body, but I'm saying like breast lift at 40, I think, maybe. What else would I get done? A tummy tuck if I need one. Hopefully I'll never need one. I'm too scared of that kind of invasive surgery. You know how it is. So hopefully I'll take care of myself enough to not have to go through that.
Thank you all so much for joining us tonight. It's been fascinating. And thank you very much, Meredith, too, for joining us from London. Really appreciate it.
My pleasure.
And that is all we have time for here, but let's keep talking on Twitter and Facebook. We'll be back next week. Stay tuned now for Dateline. Thanks, everyone.